Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey friends, welcome back to another episode of the Healing Pain Podcast. Today we're exploring how overweight and obesity are linked with persistent pain and the importance of physical therapists promoting combined nutrition, exercise, and weight loss programs when treating those with a chronic pain syndrome. Joining us today as an expert guest is Anneleen Malfliet. She is an assistant professor and postdoctoral researcher, as well as a member of the Pain in Motion International Research Group. Her research and clinical investigations center on chronic pain with a special interest on spinal pain, central sensitization, nutrition, as well as diet. On today's episode, we'll explore the broader lifestyle perspective when taking into consideration the link between obesity and chronic pain, how a clinician can assess the presence of obesity or being overweight, and then finally, how to approach weight reduction, as well as how to organize a weight management program in clinical practice. Okay, there's a lot packed into today's episode. I know you're going to gain a lot from the information and from the data that Anneleen has around the impact of obesity for chronic pain. Let's begin and let's meet Anneleen Malfliet. Hi there, Anneleen. Thanks for joining me this week for the episode.
Hi, Joe. It's great to be here.
I've been so excited to talk to you. I know we made this appointment a number of months ago, and I know you had a great paper coming out that would obviously support this important topic and so much of the amazing work that you're doing as a physiotherapist and a researcher. Off the top of the episode, I just want to point people to the paper that we're going to be talking about that supports a lot of your current work. And that paper is called Obesity Hurts, the why and how of integrating weight reduction with chronic pain management. And everyone can access that. It's an open access article in PTJ, which is Physical Therapy Journal. That's in the August 2021 edition of PTJ. Great perspective paper, lots of useful information in there for not just physical therapists, but I really think other practitioners who are working with pain also. Before we dive into that paper, I want to give, I know you a little bit and we have collaborated on a project just recently, but I want to share your information. I want to share what you're doing in pain specifically. So just tell us who you are and kind of what you're doing in the research realm.
Yeah, sure. Well, so at the moment, I'm affiliated to the Vrije Universiteit Brussel, which is a university in Brussels, capital of Belgium. I'm working there within the Pain in Motion Research Group, which is a group focusing specifically on chronic pain very broadly. And for most of my time, I've been specializing in chronic pain rehabilitation. And now the latest years, I'm even refining the focus a bit towards the role of nutrition, diet, and overweight and obesity in chronic pain from both a fundamental perspective as from a rehabilitation perspective as well, mm-hmm. which explains this paper now published. So yeah, that's what I'm focusing on at the moment and what I want to go further in.
So you're obviously a physiotherapist by training, went into research, focusing on pain management, and then you now have this line, if you will, of focusing on the nutrition aspect of chronic pain management.
Yes.
And you lead a group around that topic, is that right?
Yeah, indeed. Within the Pain in Motion research group, we have different research lines, and I'm responsible for the line specifically focusing on diet and nutrition in chronic pain. And we have currently 2 PhD researchers involved in that area.
Right, and one is Omer Elmer, right?
Yes, who also has been on the podcast.
Yeah, who's been on a previous podcast. We'll link to his episode in the show notes because he's done some great meta-analyses and some other papers on nutrition and pain. It's interesting. I think it's interesting to a lot of PTs to hear, and I think a lot of PTs will be excited to hear that physiotherapists are specifically researching the connections and associations between pain and nutrition.
Yes, sure. It feels like it goes a bit beyond our maybe the scope of our profession or what we're used to do in our profession. But I guess throughout our talk today, it will become very clear that it's really something that we cannot take apart from what we're doing. We have to consider it. Physical activity is one of the core businesses we do with our patients. And we'll probably talk about it later on, but you cannot set physical activity apart from nutrition. And especially if people are obese or if they are overweight, it has so much impact on general health, but also on pain. So yeah, you have to consider it.
Yeah, especially as a physiotherapist, it's such an overlap, as you mentioned. If you have that skill set where you can educate and counsel on obviously physical exercise, we do that very well as physios. But if we can bring a little bit more of the nutrition into it, then we can help with either treating a specific condition like chronic pain or just the general health and wellness that we look to promote in our patients, which is important. So tell us about why this particular perspective, why obesity hurts.
Yeah, well, we all know that overweight and obesity are very, very prevalent in general in the population. And we do know that it has massive impact on our general health. It is related to so many chronic diseases, diabetes, cardiovascular diseases. So it has an impact. It's a very modern problematic disease. And we see that in people with chronic pain, the prevalence rates are even higher. For example, in fibromyalgia, 80% of patients are overweight or obese. So apart from the fact that it has so much impact on your general health, we also see that it has an impact on pain levels. Not only from the specific biomechanical load. It's of course logical. The more weight you put on the body, the more physical load there is on the body. It seems quite reasonable that that's related to pain. But it goes much further than only that biomechanical load. We see, for example, that there is also some link with inflammatory aspects. We know that fat mass as such can become dysfunctional. It can release some kind of pro-inflammatory cytokines. It can add towards systemic inflammatory profile, which is also linked to chronic pain. We do know that systemic inflammation has a role in chronic pain. Mm-hmm. So in that way, it's very clear to see that there is something going on, and that overweight and obesity do add also on a more fundamental basis to chronic pain. And it's not only seen in, it's not only just a reasoning that we make. We do see even in humans, if they are overweight or obese and we have a reduction in abdominal fat, we see that the systemic markers of inflammation will also reduce, which is of course very good, but it's also linked to a decrease in pain levels, and not only in weight-bearing joints. It's more systemic overall reduction in pain levels. So it goes further than only the biomechanical load, for sure.
Really interesting. So there's a lot of things that I want to start to just go into a little bit more detail so people can take away some, great things back to either their clinic or to their research lab. So there's an association between overweight and obesity and pain. That's clear.
Yes.
Do we know, let's say, as weight increases, so there are BMI categories, let's say as someone's BMI increases, is there, does pain necessarily increase kind of in suit?
I'm not aware of any research that really gives an answer to that question. I can imagine also from the load perspective that indeed the higher the load, the higher the pain. And also from the more inflammatory perspective, it would make sense that the more fat mass there is, the more inflammatory markers can be found. but I'm not aware of any research that really specifically pinpoints on that research question.
Okay. And then you mentioned obviously fat mass. And the one fat mass that we're all most concerned about is visceral adipose tissue, which is the fat mass that's around our kind of our belly and our waistline.
Yep.
The more fat mass we have in that area, typically the worse health outcomes are. And your research is pointing toward obviously chronic pain. Adipose tissues produce, as you mentioned, adipokines, which are inflammatory cytokines, which increase other inflammatory cytokines throughout the body. So should a physiotherapist, should a physical therapist start to maybe look at one, potentially BMI and waist circumference? And then two, is there a role for us to look at, let's say, C-reactive protein or other basic inflammatory markers in blood work to get a full picture of what the patient is experiencing?
Well, of course, the first step would be BMI, waist circumference, especially go further than BMI alone, because we all know that from an individual perspective, it doesn't make that much sense to only look at BMI. But maybe rather than, I guess, of course, blood biomarkers would give you a lot of information. It might not be that specific, though. It can also, of course, if CRP is raised, it can be linked to so many other aspects. So I'm not sure if that would, if the cost would benefit the means. But I would rather say that it would be good to look at body composition. Of course, at the university, we have this very high technology scans to look at body composition, but in clinical practice, you can actually use a bioimpedance scale, which will already give you some information about fat mass, fat distribution, the ratio between lean body mass and fat mass. And I guess that would be quite easy to implement in clinical practice, probably easier than blood biomarkers.
Yeah. Waist circumference, hip to weight ratio.
Yes.
These are easy things we can do in practice to screen for this, right?
Indeed. Yeah. Yes.
And then what about the gut microbiome? There's so much talk nowadays. You know, the NIH has millions of dollars poured into research looking at the impact of the gut microbiome and the genetic factors and how it impacts our human health. Is there a role in that with regard to chronic pain?
Yeah, indeed, because we talked about the load and the inflammatory markers of and fat mass, but indeed, research, it's especially focused in animal research at the moment, also with the link with pain and obesity. But there's probably something there as well, that the gut microbiome of obese people has probably changed. There is even some research showing that the microbiome is able to collect more energy from foods in people who are obese. So it's probably also dysfunctional. And then, of course, we also know about the gut-brain axis, so which probably also makes it possible to link it to pain, chronic pain. For example, there is some knowledge on the impact of the gut on glial activation in mice, and that post-surgical they see an increased glial activation in the mice who are obese, which again shows that there's probably something there, that there is also a link again then with inflammation, but it's very new research. I think it will give us a lot of information, something that indeed like NH, but also other grants are focusing on. So it will probably give some very exciting and very relevant new insights in the future for sure.
Yeah, and you mentioned dysbiosis, which is a shift in what one would identify as a healthy microbiome to one that is, as you mentioned, dysfunctional.
Yes, yeah, it has. Oh, sorry.
Go ahead.
I'm not. I don't remember the exact names of all the bacteria, but indeed there becomes a disbalance and an overactivation of certain bacteria in the gut that normally in a healthy gut would not show such an activity.
Yeah, I mean, and you're right. The research on the gut microbiome right now is most prevalent in looking at conditions like general obesity or diabetes. And that has shown different types of bacteria like Firmicutes and Bacteroides, change in composition. Chronic pain, we're learning. I know there are a couple of studies out there about fibromyalgia specifically, but we need more data on CRPS and low back pain and, all the different chronic pain syndromes. So it is exciting to watch that data develop.
Yes, true.
Yeah. As we talk about, you and I are obviously clinicians, and we're talking about weight reduction and obesity, and we both know it's a really important topic. It's also a very sensitive topic for people who have been struggling with being, not only struggling with chronic pain, but they're struggling with being overweight also. And clinicians now will access this information, this interview, and they'll start to talk to their patients about this. How do we start to open up and unfold this conversation in a way that doesn't stigmatize someone, in a way that we're not saying obesity is the exact cause of your pain, but it's a component? How do we start to do that in a way that's compassionate for people who have been, struggling?
I think it's a very, very relevant and important question. And it's something I'm actually also a bit struggling with when I'm talking about this topic, because of course I really want to support body positivity and the whole movement around it. But we cannot go around the fact that overweight and obesity do have a lot of negative aspects as well. So I do think it's always best to not focus only on weight, not just for the patient and for the perspective of the patient, but in general, I think we do need to consider chronic pain from a really broad perspective, from not only the biopsychosocial perspective, but also the lifestyle perspective. And in that way, it's very logical to consider, for example, I would assess physical activity, sedentary behavior, then the weight would be somewhere there as well. I would consider stress, I would consider sleep. And like this, I guess the patient feels that the pain is being looked at from different kinds of perspective, different viewpoints. And the weight is only one part of it. So it does not put the focus on it directly. And well, I guess as physiotherapists, we are all very well aware of communication, we also have this kind of feeling of how to communicate with the patient, but also to feel which aspects might be a bit sensitive. So I guess throughout your therapy with your patient, your therapeutic alliance will grow. There will be much more comfort and confidence from both sides, and I guess that will open up possibilities to discuss about the weight and about diet and nutrition. And I really do believe, since we see the patient so often on a regular basis for 30 minutes, at least in Belgium, in some countries even longer, I think that really gives a lot of opportunity to open up the discussion, and we have so much more possibilities to communicate and discuss with our patient and other health professionals. So I guess we're very well placed to at least try to find a way to discuss it.
I agree. I mean, there's tremendous opportunity there for physiotherapists and other professionals who are working with this patient population, really have some time. As I'm listening to you talk, I'm also noticing that there's a fair amount of clinical decision-making that has to happen here as a physiotherapist. Because as we're acutely aware of the biopsychosocial approach to pain, now it's like, okay, well, what aspect is most important? And even in our conversation, you're talking about obesity being an inflammatory condition, which it is. That data is clear, and that inflammation has an impact on systemic pain. It also has an impact on neuroinflammation, so inflammation in the nervous system. But pain neuroscience education, for example, has spread the message that inflammation isn't necessary for chronic pain. With chronic pain, there is no inflammation, so to speak. So now we have to balance this. Well, inflammation isn't necessary, but there are people who do struggle with inflammatory components that are significant. And now we have to figure out clinically, okay, what am I targeting first?
Yes. In general, I think it's chronic pain is so complex. So I can imagine that many clinicians are struggling, as you said very well. And indeed, well, we all know about pain neuroscience education, and I'm actually in the trial that I'm conducting right now on overweight and obesity. I'm also giving those patients first pain neuroscience education. But I think, like in any patient, you really need to individualize the content of your education you are given, and it should also be more related to the case of the patient. For example, if a patient has sleep problems, you can also integrate the sleep problems within the education. And I guess the same applies for overweight and obesity. You can moderate the education you are giving to make sure that it fits and the story is well aligned. And I guess that's the flexibility that pain neuroscience education actually gives, that you can adapt. I also don't think you have to maybe explain everything very much into the real details to the patient. We use in the education we are giving, we use a lot of metaphors. We do explain what is happening neurophysiologically, but on a very understandable, in a very understandable way, a way that someone who is not medically schooled explains what you're saying. And I guess in that way, it is possible to also include the information on overweight and obesity, even if you see that your patient does not find or is not open to the neurobiology after in the story. You can use the most easy way to explain the impact of overweight and obesity, which is load, and which will be so easily understandable for everyone.
Yeah, load is easy for people to understand versus, let's say, neuroinflammation, so to speak.
Yes.
Yeah, and I think the suggestion of contextualizing pain education for the patient is really important. So it doesn't just become a broad stroke where you're saying, okay, how do I adapt this really important psychoinformation for this particular patient and what they're struggling with? And I think that's really important.
Yep, indeed.
So as a physiotherapist, how do we begin to implement weight management into clinical practice? It's not something that it's not so common. It's becoming more common. People are aware of it.
Yeah. Well, again, it's indeed not that common, but I do feel if you want to embrace the complexity of chronic pain, you have no choice rather than include all kinds of lifestyle factors as well. And here I think, firstly, of course, you need to assess your patient. So we have to include an assessment on, well, of course, body composition, body weight, but then also specifically on the diet, on nutritional aspects. Next to that, from which is called the energy balanced behavior perspective, you cannot look at nutrition alone. You have to also consider physical activity, because of course, weight, very easily said, is a result of what you consume and what you use as energy. So you have to consider physical activity, you have to consider sedentary behavior. So this way you get a complete picture of your patient. Diet can be easily assessed using a food frequency questionnaire or a food diary. It can even be done online. So it's something the patient can do in advance. You don't have to spend too much time in your first contact moment with the patient on that assessment. The same for physical activity and sedentary behavior, although we do see a lot of over-reporting of physical activity when you just use a questionnaire. So we have to be a bit careful when using only questioning for that aspect. But then as soon as you have the complete picture, as soon as you have all the information, I guess we would first start again by educating the patient. Firstly, on the role or the link between pain and diet, the specific aspects of diet that can influence pain. Also the influence of overweight and obesity on pain, the influence of physical activity on pain to make sure that the patient understands the importance of all those aspects. Next, the patient should also know what a healthy diet is. Mm-hmm. And where the differences lie between a healthy diet and the diet they have. Again, that's quite easy to use a food diary for that. If the patient notes down very good what they're eating, they can actually, after some small education, they can screen for it themselves. They can look for behavior that should be changed. And if they have an example of a healthy diet next to that, they can try to make the changes themselves with you as a coach, of course. And for a healthy diet, I think there are always national guidelines available that we can check as physios. The EatLancet Commission has also published a very nice perspective on a healthy, sustainable diet from a more global perspective. So there's a lot of information available. And then lastly, well, if we would consider weight management, I think there are two very important aspects. Of course, the diet to reduce calorie intake or to just make it more healthy. But next to that, physical activity to increase the usage of calories. And then physical activity, well, it's not only a component that is important for weight management, but it's also a very important component of chronic pain management. Mm-hmm. So I guess the physical activity aspect is actually the one linking chronic pain management to weight management.
So as professionals, we see there is kind of this 3 level of a physiologic basis behind this. So there's a biomechanical load, there's changes in the gut microbiome, and there's neuroinflammation. So we have that science, and we can use that science, as we mentioned, to support what we're doing. We can use it as part of pain neuroscience education. And then when it comes to the actual treatment, we're going to ask the patient, of course, to make sure that this is something they want. So we're asking, we're going to assess. You can use BMI, food frequency questionnaire, start the conversation. There's so many ways to look at nutrition. And then physical activity is something we understand as PTs and know how to kind of dive into. And then but I really take home from what you said, there's so many really good educational opportunities for us to talk about exercise and physical activity, as well as diet and nutrition. Like those 2 subjects alone can keep you busy for a whole year with a patient, right?
Yes, it's a lot of information you can give your patient. That's true. And when I was at the moment, I'm also conducting a trial where I do weight management combined with chronic pain management for people with chronic low back pain and overweight or obesity. And while I was composing the trial, I had the same reflection, and I thought, okay, this is too much to consider. And I actually made parts of the program online to have a track that the patient is doing on their own. And when they come to clinical practice, we can have some feedback moments. I can take a coaching role. But most of it, the patient is doing alone to especially gather the information, because that's something that they can do on their own. And then with their specific questions, their specific issues, barriers they're experiencing, there you as a coach or as a physio can step up and can help the patient. And of course, this asks a lot of independence of the patient and a lot of activity from the patient. But it's not very unlogical to consider that kind of approach because, well, not only for the dietary intervention, but also for the physical activity intervention, it's behavioral change.
Right.
And you do need an active patient, an involved patient, a patient who really wants to change to make that happen. So I guess from that perspective, it's quite logical to put a lot in the hands of the patients.
Yeah. And when we look at studies on either diet alone or exercise alone or combined, of course, there can be very long year programs. I think there's a randomized controlled trial on, I think it's obesity and knee OA, where it's a year-long program. That's a long program, but they get a tremendous amount of change from that. But the important take home, I think, for clinicians is to know that with just 5 or 10 minutes, which we would identify as brief interventions, you can still change someone's behavior and change either their eating pattern or their exercise pattern in substantial and impactful ways.
Yes, sure. And well, again, from the behavioral perspective, in those studies, it's not uncommon to use a very long approach where they see a patient for over a year. But I do think that's feasible in clinical practice as well, that you would start seeing the patient in the beginning from a more regular basis and then kind of organize some booster sessions because well, when we look at the stages of behavioral change, when you are in the maintenance phase, there is always a chance on relapse. So in that way, it's quite logical to have some sessions with your physio to just check how things are going and to keep the patient a bit closer for a longer time to ensure that the behavioral change is maintained.
Yeah, I appreciate that perspective. I oftentimes interview researchers and they conduct a 8-week trial and that just kind of ends there basically. But we know, I think, when you're in clinical practice, you realize people need a lot more support and they need it for a longer period of time. So the idea of, twice a week for 8 weeks of physiotherapy is wonderful, but the relationship doesn't necessarily end then. We can continue to monitor people. Even nowadays, there's ways to monitor people remotely with technology, which is having a useful place for all of us, both patients as well as practitioners.
Yeah, indeed. I think there are a lot of opportunities to do it, and we can think out of the box there. But I agree that it's good to guide the patient for a longer time, and not only when we are talking about diet. It's in general, chronic pain patients could benefit from that.
So we've been talking a lot about nutrition as a PT/physiotherapist. In the United States, nutrition is part of our scope of practice. More and more PTs are using nutrition. We live in a big world, so to speak, and the physiotherapy profession is different in different countries and different geographic zones. What's your recommendation to countries where physiotherapists look at this as out of their scope, or we can't do this, or we're not licensed to do this? How are you starting to break down some of those barriers?
Yeah, I guess that's something that a lot of people will run into, not only from a general perspective, but maybe also individually, that they feel that they don't have enough background knowledge. So from an individual perspective, I would advise to educate yourself. Like we've been saying before, there's a lot of information available, national guidelines, international guidelines. So I guess that's something you can do. And again, from the lifestyle perspective of chronic pain, you cannot set aside nutrition. You cannot only focus on physical activity. So I guess you would have to assess it at least. But if you do feel that the case is too complex or that it goes beyond your knowledge, of course, referral to specialized care is needed. And I think it would also, of course, be beneficial if you could work in a multidisciplinary way where a lot of professions are working together for one patient, not only to include a dietitian, but for example, within the biopsychosocial perspective, to work together with a psychologist. That would also be very, very beneficial. But if you don't have those options, if you can only work in a monodisciplinary way with your patient, again, I think it would be almost unethical not to give at least some advice on diet, to make sure, especially in obese and overweight patients. And again, if you educate yourself, there is so much information available. You could give some general advice to your patient, at least on a healthy diet, without going too much into details if you don't feel comfortable doing it, or if you feel that you're at the boundaries of your knowledge.
Yeah, and as you mentioned, that there are national guidelines in most countries. Sometimes the national guidelines are a little bit different. I've looked at many different national guidelines on nutrition. But you did mention the EatLancet, which I think is really important. Can you tell us what EatLancet is and what their general nutrition approach is? And it's really, I also think it's important to note that nutrition does have an impact on the individual, but also has an impact on community, on society, on the environment, on our globe, et cetera, et cetera.
Yeah, and that's actually the nice thing about EatLancet. It's a commission with a lot of experts on nutrition, on diet, on general health, and they all work together to give a more international guideline on a healthy diet, but not only, as you mentioned, for the individual, but also a diet that is actually sustainable. Which does make a lot of sense with the current society at the moment. So the diet that they propose would be fine for all kinds of countries. So if you don't have national guidelines, or if the national guidelines are you don't feel like they are sufficient, you can always look at their reports, which is also freely available. And the main focus of that diet is actually a plant-based diet. So it focuses mainly on nutrition from a plant origin, plant-based origin. There is still some room for animal-based products, but very, very small. So let's say the main component is plant-based. So this involves, of course, fibers, fruits and vegetables. I have to think about. I have been talking a lot in Dutch about this diet. I have to think about the words in English. But in general, plant-based is the focus there.
Yeah, it's similar, not exactly the same, but it's similar to a Mediterranean-based diet.
Yes.
Where it's mostly, as you mentioned, plant-based, at least 5 servings of fruits and vegetables, nuts and seeds a few times a week. Yep. Red meat is sparingly, probably once a week, maybe twice.
Yes, indeed. Avoiding empty calories is also an important one there.
It's still such an important topic. I mean, just avoiding the processed foods, added sugar, empty calories is a big deal in the world of nutrition. Yep.
Yep. Yeah, indeed.
Right. So EatLancet, we'll link to that in the show notes as well. It's a nice global way to look at nutrition. As you mentioned, it's sustainable. So there's some environmental and economic factors there as well that people are concerned about. When you start to talk to people about nutrition, you do hear things like, I don't eat meat because I don't think it's sustainable, or I don't feel like it's ethical. So those are important considerations when you start to work on nutrition. Anneleen, it's been great speaking to you today. And I want to point people back to the paper. So it's called Obesity Hurts, the Why and How of Integrating Weight Reduction with Chronic Pain Management. It's in PTJ, Physical Therapy Journal, August 2021. What's next for you? You mentioned a couple of things you're researching, but what do you think is really missing from the literature based on nutrition and chronic pain, or the kind of topic we've been talking about? It's a big topic.
Yeah, and there's so much. There's so many topics that I'm considering for future research. So as I said, at the moment, I'm conducting a trial on weight reduction in obese people suffering also from chronic low back pain. I'm also thinking about, because in that trial, we mainly use patient-reported outcomes, and I'm also thinking about including more fundamental outcomes in next trials, like inflammatory markers, but maybe also something about the gut microbiome, because there are some very interesting things going on at our university related to the gut microbiome. It's not linked to chronic pain, but I hope to maybe make an alliance there. And then there's also, of course, the big world of epigenetics and nutrition and epigenetics. So maybe there's also something we can do in the future related to chronic pain. And then lastly, that's something, well, I haven't been doing anything specifically, but I really do believe that there is something to say about the triangle of diet, sleep, and pain, because sleep influences pain. We do know that, but we also see that people who don't sleep well make poorer choices in nutrition. So I think it's also something, a very nice opportunity to link all those three things together. So I have a lot of things I want to do in the future.
It's true though, when people change their diet, they oftentimes sleep better.
Also, yes. Mm-hmm.
Yeah, so it's really interesting. Well, we're going to be looking out for your work because it's really interesting work. I think as physiotherapists, we've been waiting for this kind of work to see more about diet and nutrition and how it impacts all the different types of conditions we really see as physiotherapists. Of course, chronic pain is high on the list. Tell us how we can follow you and how we can keep together on your work.
Yeah, well, you can, of course, check the website of our research group, which is paininmotion.be. From the research group, we also have many social media channels. You can find us on Facebook, on Instagram, on Twitter. And for me personally, you can also find me on Twitter just using Anneleen M, which is the first letter of my last name. But I guess that's the ways to follow me.
Great. So we'll link to all that in the show notes, both the Twitter handle as well as the Pain in Motion group. So it's paininmotion.be. Everyone can go there and check out the Pain in Motion group. They have great information, wonderful researchers who are doing great work like Anneleen. And you can tweet to Anneleen at AnneleenM on Twitter. I want to thank all of you for joining us this week and listening in on this important topic on Obesity Hurts. Make sure you share this episode with your friends, family, and of course, colleagues interested in the intersection between weight reduction and chronic pain management. I'm Dr. Joe Tatta, and I'll see you next week.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit Integrative Pain Science Institute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.